As social workers for Open Arms Shelter, we realize that the COVID-19 pandemic poses a huge problem for us and those we serve. COVID-19 stands for Coronavirus Disease 2019 and is a highly contagious, sometimes fatal virus that infects the respiratory system via respiratory droplets of those who are infected. While some people are asymptomatic, those who experience symptoms have reported dry cough, fever, and shortness of breath within 2 to 14 days of exposure. The elderly and those with pre-existing conditions are more at risk of infection and death. Currently, there are no vaccines or treatments available. However, respirators can be used to help patients breathe. As of April 4th, 2020, the total cases in the United States were 277,205, and the total deaths were 6,593, according to the CDC. Preventative measures include social distancing at least 6 feet, no gatherings, constantly and consistently washing hands for at least 20 seconds, sanitizing and cleaning surfaces, avoiding those who are sick, and wearing protective gear such as masks and gloves. So far, 41 states have also mandated complete stay-at-home orders. What does this mean for our homeless population, or the homeless population as a whole? Our task force will focus on the problem at hand.
Currently, Open Arms serves as a short-term shelter for women and families, a daily lunch for all, and a night shelter for men. This revolving door and current setup of living space presents a huge problem in relation to exposure to COVID-19. If any one of our current live-in guests or visiting guests gets the virus, the entire shelter, including workers, are at risk. Due to the in and out access, this also means that the general population is at risk and the families of the workers. This does not slow down the spread nor help our already vulnerable population.
Our population consists of 650 women, children, and families, and 200 men. Like most homeless shelters, our facility has close living, sleeping, bathing, and eating quarters, and resources such as sanitation stations and essential hygienic supplies, testing kits, thermometers, and protective gear are absent or limited. Even before COVID-19, homeless individuals under the age of 65 already have a 5 to 10 times higher mortality rate and are considered an at-risk and hard-to-track population. Previous contagious outbreaks such as hepatitis A, tuberculosis, and trench fever have greatly affected the homeless. The estimates for COVID-19 amongst the homeless population are twice as likely to be hospitalized, 2 to 4 times as likely to require critical care, and 2 to 3 times as likely to die. To stop this, we need more access to state and federal emergency funding, the ability to use vacant hotel rooms, churches, and/or other spaces to provide housing, community support and volunteerism, along with donations. Cities all over, but especially large cities with greater homeless populations, face challenges with COVID-19 and the risk of how quickly it can spread through that community. Key stakeholders are the CDC, state legislators, governors, mayors, and local health authorities. Currently, the CDC is releasing variations of data and guidance to the public and service providers, including hospitalization and death of those infected with COVID-19.
Now that we can see how COVID-19 has affected communities across the country, what can we do to change? What changes can be done basing on a meso and micro to assist? It is important to understand that social media has spanned across various countries and the internet is at its highest peak today. To help on a meso-level basis, staff, clients, and any outside providers should begin using more electronic collaboration between each other, as well as utilizing social media to help post and share information, providing support for those across the country, and widespread seeking donation funds as well as volunteers. As far as the macro level, by applying for all that is available funding through state and federal, as well as getting supplies and proper equipment, the usage of public health crisis will also help create more awareness pertaining to those who are homeless and dire need of help during the crisis. It is also important to understand that by communicating with state and federal health and human service authorities will help move and drive them collaborating to help. The challenge of housing homeless members of our community does not fall at the shelter system alone. Many service organizations are also making accommodations to ensure the most vulnerable members of our community have protections and basic access to care. There are now telehealth appointments that are available for primary care, mental health, and substance abuse treatment, including that all major insurances have waived copays for the telehealth appointments as well. As far as public transportation, this will be free during the COVID-19 crisis as a public health emergency. Social services will extend due dates pertaining to recertifying for public assistance, as well as statewide hold on all evictions for at least 90 days. Finally, all orders of protection have been automatically extended as well for 90 days.
Some specific change strategies and tactics we will implement include locking down the facility until the state of emergency has ended, building sanitation stations for personal hygiene, having the facility deep cleaned weekly, arranging the physical space so that the beds and dining tables are at least 6 feet apart, while also making sure that there's a rotating schedule of activities such as bathing, eating, and entertainment so that our guests aren't all engaging in these activities at the same time in order to maintain social distancing. We will also create isolated quarters for suspected individuals of the virus, have a nurse and licensed social worker either on call or stationed at the facility, increase digital organizing and social media community, and obtain testing kits. The plan to implement the meso-level changes, which are those within our open arms population and facility as a whole, is to work directly with the shelter's leaders and staff to accomplish our goals. In order to implement the macro-level changes, which include the greater homeless population, federal funding, and community involvement, we plan to run a social media campaign to raise awareness of the effects COVID-19 can have on the homeless population and how the community can get involved in donating and assisting our at-risk population. Our meso-level change efforts will be evaluated by assessing whether or not we've maintained at least 95% of our original residential population, secured off-site properties for at least 95% of our daily and nightly visitors, and actually installed the individual sanitation stations with logs to reflect usage. Our macro level change effort would be evaluated by assessing whether or not we received the targeted dollar amount of federal and state funding requested, have access to testing kits, and that our social media campaign and fundraising efforts were great enough that we received enough donations so that all of our residents, whether on-site or off-site, have the proper PPE such as masks, gloves, personal sanitizers, and other donations asked for so that they can survive during this pandemic. This is how we will know if our efforts were successful.